Okay, so this is an ABC approach to medical treatment for non-medics. Uh, I'm going to show you two approaches. This one has a little more text. The other one's a flowchart. So the ABCs. A is assess the injuries. You might ask questions like which body parts are injured, how badly are they injured, what kind of wounds do they have, is there bleeding, how much blood has been lost, that sort of thing. First thing you do, assess the injuries, see what's going on. Next, bleeding needs to be stopped. If any limb is injured moderately or heavily, apply tourniquets to an injured limb. Before you need to take care of different other parts, you're going to put a tourniquet on any limb that's bleeding significantly. If the head or torso are injured, bandage them first. Use elastic bandages to start and add quick clot bandages if you do not expect to get to a medic soon. That's a general approach. If the wounds on the head or torso are very serious, even if you think a medic is just a couple minutes away, you probably want to throw a quick clot on there to try to prevent reopening. 3, then you go on to bandage injured limbs, and 4, remove any tourniquets after the bandaging is complete. Once the bleeding is under control, the patient's considered stabilized, and the patient could be you. Go on to the C, control the pain, and if the patient's in significant pain, inject morphine. Once, 1 morphine. And then we throw in a D, decide about medic. Is a medic needed? Yes, if, and this is very debatable, but we're going to give you general guidelines. If the patient has lost a lot of blood, and you're going to need some sort of IV, saline or blood or something, to get your blood pressure up, or if the patient has multiple wounds that need stitching, or if the patient has an ongoing weak heart rate, which can happen due to the use of morphine, and epinephrine would help with that. In our 2nd Battalion, I believe riflemen, everybody's okay to go ahead and give them self-epi. That has its own minor risks to it. Well, minor for our game. So 1st Battalion doesn't allow that, which is partly just to give medics more to do. Next, I want to show you this flow chart. And this is another way to look at it if you're more visual. So if you start here, the first question to ask is, does the patient have a pulse? Now remember, you could be treating yourself or someone else, obviously. If you don't have a pulse, then you'll know. But if you're treating someone else and they don't have a pulse, well, move on. If the patient does have a pulse, or as ACE Medical says, if they are responsive, then the first thing you want to ask is, are they wounded in the head or torso? Because those are going to be more dangerous. If no, the red arrows mean no, then you ask, is the patient wounded in any limbs? Well, if they're not wounded in the head and they're not wounded in the limbs, they don't have injuries and you can move on. But assuming the patient is a yes, they are wounded in the head, then you want to ask, is the patient badly wounded in any limbs? If so, bandage injuries to the torso. Sorry, if they're not wounded in the limbs, but they are wounded in the head, bandage the injuries to the head and torso. If they are badly wounded in any limbs, apply a tourniquet to the badly wounded limb or limbs, and then bandage the injuries to the head or torso. Then we're going to go down to here. That should probably be black, shouldn't it? Let's change that now. Okay. Black meaning you're just going to flow from there necessarily. Then, after you've bandaged the head and torso, you're going to go down and bandage the injured limbs. This is the same where if you say the patient is not injured in the head or torso and the patient is wounded in a limb, you go down to the next step, which is to bandage the limbs. There's complications like, do you want to use tourniquets depending on how many injuries, how many limbs are injured, and how serious they are? I think you'll get the idea. When you're done bandaging limbs, you remove any tourniquets. Don't forget to do that on yourself or someone else. And then you ask the question, is the patient in serious pain? If they are, then inject morphine. If not, then move on. And now you're at the decide step of are the injuries serious enough to get stitches and see a doctor? And if they're not, then if the injuries are light to moderate and you've put quick clot bandages on them, they'll probably stay shut for long enough that you can wait 10, 15, 20, maybe even more minutes. You might have to reapply a quick clot or something, but you should be okay to wait to get more serious medical treatment. So that's our little flow chart. Moving on.